How do we define physical rehabilitation? I narrow it to two words, and that is pain and function. We are trying to treat any illness or injury in order to decrease that patient's pain and at the same time restore or at least improve their function. So you can just see a couple of patients here. This patient on the top had a shoulder injury, but consequently to that shoulder injury, he had a lot of stiff muscles. So we're including massage. So it's not just about treating that one injury, but the surrounding tissues. And this is a guide dog who had a tumor on his shoulder blade. It was an osteosarcoma and had the shoulder blade removed. And he could barely sit down and stand up. So that's a major problem with his function that we had to be able to return for him to be able to be a guide dog again. So we really address all mobility disorders when we're talking about physical rehabilitation. And rehab comprises a variety of different areas. Probably the one that gets the most attention, I think, from really good marketing is the modalities, what we call the therapeutic modalities. These are devices or applications of a physical agent. So it could be light, it could be sound, it could be electrical, and they transfer that physical agent to the body for a therapeutic purpose. So you can see a few pictures here on the top. It's a dog that's receiving a post-operative rehabilitation treatment after a TPLO surgery. He's receiving compressive cryotherapy. So this is a device that is compressing over the leg that had surgery and circulating cold water around it. So that's going to help decrease pain and inflammation. We're also delivering pulsed electromagnetic field therapy, TENS therapy, which can help to reduce pain. The dog here with the cute goggles is receiving laser therapy, and on the lower right is the patient receiving extracorporeal shockwave therapy. So lots of different physical agents that can take that energy and transfer it to the body for a healing purpose. The other aspect is manual therapies and therapeutic exercise. The first category, I would say, is what we call recumbent therapy. So their dog is lying down for these. This can include things like massage, stretching, passive range of motion. I'm actually doing a demonstration here on my personal dog that I use in training my interns and residents on how to appropriately do range of motion. You'll notice that I'm holding the limb parallel to the body. I'm never pulling on the paw. It's a very gentle guiding. And what I'm doing there is putting the ankle or the tarsus through a range of motion. It should be very well accepted by the patient. But beyond those types of massage, stretching, passive range of motion, we also have, of course, therapeutic exercises. And this can include a variety of categories such as strengthening, balance, coordination, proprioception, which is improving the body's awareness in space, as well as task specific. So, for example, this patient here, we're doing what's called a 3-leg stand, which is improving hind limb strength to the remaining 3 legs, but in particular, that remaining left hind leg. And when we're talking about task-specific therapeutic exercises, that could be for our athletes, for example. We have an agility dog that incurred an injury. And when we're devising that therapeutic exercise program, we wanted to take in all of these aspects: strengthening, balance, coordination, proprioception, task-specific. So really, I would argue that this section of rehab, the manual therapies and the therapeutic exercise, is in fact the most important aspect of rehab, because that's what really gets them back to function.